So we are in the middle of the crisis due to the coronavirus pandemic. We have reasonably done very well last time when there was the first wave of the coronavirus. Due to various reasons, I think the second wave has hit us hard and we were literally unprepared this time. And this has led us to a lot of complications, increasing numbers, deaths, lack of resources, and a lot of confusion out of that. Now, it is necessary that while we are able to handle this collectively, also to be prepared for the future as well. So when such effort is laudable effort by the Prime Minister of India is that to pool all the medical resources that are available in the country. It is necessary to have such preparedness to pull back all the medical students, interns, postgraduates, including the nursing students and the medical volunteers if necessary when there is a real need. And we should all be prepared to fight the battle. So it's like a war situation where you will get ready and to fight the situation. More or less is a medical war that we need to prepare ourselves. Now at the same time, when we do that, we need three important things here. Number one is a medical guideline. What is the treatment should be given for these patients, and triaging should be very strict. Therefore, we can conserve the resources, conserve the manpower, utilize the resources very effectively. And we need to prepare this urgently. What is the national guideline medical treatment that is being recommended and should be uniform across rather than each state, each hospital following a different protocol for the treatment. Of course, we are all aware there is no definitive treatment as yet proven, yet whatever is the guideline should be uniform across the country. The second most important thing is while we are calling these young lads, medical students, interns, and it is important that we need to take care of the medical professionals as well. Otherwise, our resources are going to get hit hard very soon. So in the bargain of the preparation for that, I think we need to define the standards which they need to follow. Unfortunately today, the so-called universal precautions are not known to the medical students at all. Many of them have not seen such universal precautions to be adopted in a situation like this or in any emergency room where we do not know what kind of patients we are going to deal with. So it is important that we educate them before they bring them to the system adequately. That's number one. Number two, I think we need to define the uniform standards across, regardless of what kind of hospital, what is the level of the hospital, medical college hospital or a private hospital, nursing home, regardless of the size of the hospital, we need to have uniform policy to protect the health workers. Particularly the goggles, the head cover, face shield, the standardized masks, PPEs, leg cover and gloves that should be disposable, and facility to wash hands frequently, and all these facilities have to be implemented across all the hospitals before we declare them as eligible to treat the COVID patients. At the same time, it is mandatory that we train these people. You know, it's like taking the army without knowing how to handle the guns into the war is going to be disastrous. So we need to train all these people who are coming as a young entries into the battlefield to follow very strictly, so that two great advantages: they won't get the infection and they won't spread the infection to others. Both are equally important, otherwise that can become a serious source of contamination and spreading the infection to the others. Now the third important thing, I think we must give guidelines for the public, and all the three guidelines, like the medical guidelines, the guidelines for the healthcare workers and the guidelines for the public, have to be implemented and enforced strictly without any compromise. And Finally, the preparedness initiative should include finding out all the resources is one thing, how best we can use the utilizers as far as the categorization effectively, efficiently is the second one. Third, how well we can protect the resources is a third important factor. When we create such a systematic approach, I'm sure we will be able to win this battle successfully and make this country free from the COVID.